if I'm helping, KETS is helping the industry, means we should make available the pharmacist in the system. How many? So I think out of 35 candidates, like very few passed.
Right.
All others failed. I didn't fit in there, and I fit in here really well.
Right.
And why I didn't, and that's where I can clearly explain to them and help them this transition. To be honest, pharmacy, because for internship, the pharmacy owners, or there should be a pharmacist as a mentor. Okay, so they have to register with the pharmaceutical society.
Right.
They have to go through that training, and then only they can become a preceptor.
Right.
Okay, and they are investing their time for these candidates.
Right.
And it doesn't come fruitful.
Right.
Because they fail, right? Yeah.
Kia ora and welcome everyone to the KETS Podcast, where we discuss and talk about New Zealand pharmacy industry. Today we are tackling one of the most pressing issues in Aotearoa New Zealand's healthcare system, which is the growing shortage of pharmacists. So we're continuing our discussions. In this session, we are addressing the industry crisis and the patient safety. With me today, we have once again Ms. Rajeswary Padmajan, who's the founder of KETS Consultancy Services and who is a pharmacist, a researcher in the field, and a mentor. So welcome once again, Rajeswary, to our podcast.
Thank you, Pritesh.
Right, to get us started, I'd like to ask you that we have noted that pharmacies are sometimes so desperate to hire that they compromise on basic requirements. What are the real-world risks of this, and specifically regarding clinical outcomes and patient safety?
Yeah. They compromise the requirements. I would say they cannot compromise actually, because to bring the overseas pharmacists here, they have to go through, they have to meet the minimum regulatory requirements.
Right.
And they have to get registered with the New Zealand Pharmacy Council.
Okay.
Yeah, definitely they might have done that.
Right.
Yeah.
Right.
So maybe the requirements that they didn't have is they don't have any orientation about what we are doing, KETS is doing.
Okay.
The cultural adaptation training or introduction or orientation of what is happening in the pharmacy.
Right.
And it will take time for them to settle down in the pharmacy, as we discussed before.
Right.
So when a pharmacy hiring an overseas pharmacist directly, then they have to face all these pressing issues.
Right.
Yeah, because they just meet the requirements. Sometimes, actually, in fact, New Zealand pharmacy needs they don't need even OPRA to start working as a pharmacy graduate.
Okay.
Yeah.
Right.
They just need a language requirement, and then they can go with their documentation and go with the initial assessment with the pharmacy council.
Right.
Yeah. Okay. And then they will approve once the application is approved.
Right.
They will say, okay, now you have to go with the OPRA training, pass OPRA, and then legislation course.
So while they're working in New Zealand.
Yes,
okay.
yeah.
Okay.
So now it's all changed, because we directly they meet all the requirements there, and they're coming here, even they are trained,
Yes.
Long before, it was a different scenario.
Right.
People come here as I said, just meeting the language,
right,
and getting approval from the council,
right,
and working in the pharmacy they have to meet all these requirements.
Right.
And it will take like 4 to 5 years for them to register as a pharmacist.
Right.
Yes. Because within that time they have to they will go for the KETS training, and they will go for the opera training, and there is validity for it, and then they have to go for the internship, 1 year internship, and then they have to register, and again internship, the first attempt, if they don't pass, they have to go for the other attempt.
Right.
This is how it was before.
Right. Okay.
But now we are fast tracking it.
You are fast tracking.
Yes, we're fast tracking it.
Yes.
And any pharmacies, if they want to hire a overseas pharmacist, like if they want to hire through KETS, then they come with all this training, and at least they go through this cultural adaptation. They know what is the expectations here, and it's because culturally it's huge difference.
Correct.
Especially from most of my candidates coming from South India, and the culture, and here it's completely different. Yeah.
So technically they're probably the most brilliant.
Yeah.
But when you come into a foreign setting,
yes,
it gets a bit difficult.
Yeah.
Yes.
They learn quite fast.
Right.
Yeah, but actually the culture is like it's like a blood supply. Like it's not just the change. It's kind of like a blood supply. It's like everywhere it's there.
Right.
It's not just the communication.
Correct.
It's not just how. So it will take time.
Correct.
For them.
Absolutely understandable. And when we talked about compromising the patient quality, patient safety.
We had, coming to that topic, we had a serious issue, like, the adverse events reported.
Right.
Yes, something like patient, the infant death, and you might have known, everyone knows in the industry.
It was in the
news.
Yes.
So patient safety.
Right.
Yeah, that's the other aspect.
Right.
Yeah, with the pharmacies are struggling, burnout, staff shortage, but patient safety is also a problem.
And that's one of the most important.
Exactly. That's again, we support this training.
Right.
Yes. So that they when they go to the pharmacy, start working in the pharmacy, they know what they expect there.
What the expectation is. Okay. That's very good, because they are still non-technical soft skills, so to speak, that a pharmacist needs to have before they can confidently serve the patient. And what the KETS services are doing, or the product is doing, is upskilling them from way before they hit the ground running in New Zealand. And they were prepared, not just technically, because technically they have done their pharmacy graduate or pharmacy degree, but you're also teaching them on the New Zealand pharmacy technical aspects of things, the systems, but also the how to settle into this foreign country with the cultural adaptation. Because at the end of the day, chances are the customers they are facing would be Kiwis who are so used to the New Zealand way, not the candidates' way, right?
No.
That's brilliant. That's brilliant. Okay, the other question I have is many overseas pharmacists struggle or fail during their 1 year internship here in New Zealand. Why do you believe that a standard 1 year internship simply isn't enough to bridge the gap for these candidates?
We'll go back again. We discussed all that.
Yes, we touched on it.
Yes. As I said, the cultural differences, and that affects, because communication comes from a different culture, has different level of communication. That's why the different regions, we have different countries speak different languages.
Correct.
Right?
Yes.
So why they speak this way, it's because of this region. And why these overseas people speak that way, it's because they are from, so it's different. So where we can find that common ground, that's what I'm trying. That's what I'm helping them.
Okay.
Yeah, because that only like because I passed through this, like I travel or I had this journey.
Right.
Yeah.
You know the
Yes,
system
yes.
because you have been a part
Yes,
of this.
yes. I have been this the cultural journey.
Right.
To be honest, like I was feeling so good that when I came here, I feel like I fit in here. I never fit in there.
Right.
So it's because obviously because of that.
Yes.
I can understand the difference.
Right.
Okay,
Right.
this is where I start. I didn't fit in there, and I fit in here really well.
Right.
And why I didn't, and that's where I can clearly explain to them and help them this transition.
Right.
Yeah.
Now, I really like it that it's not just research and theory knowledge
No.
that you are helping build your services, but you have been a result of the system and
Yes.
all these various touch points
Yeah.
where you saw what is hard or what could be improved.
Yes.
And then you have formulated a product
Yes.
that will help the next candidate on the journey.
Yes.
Nice. I like that. And so you are actually bridging that gap for our candidates
Yes.
through this.
Yes.
And when you talked about the standard 1 year internship,
Yeah.
tell us more about that. What is the 1 year internship?
That's the other thing. We just touched base that pharmacy is directly hiring part.
Right.
Yeah.
Okay.
So when lots of like mainly chain pharmacies,
Right.
they directly hire pharmacists from overseas.
Right.
Okay. So they comes with all the requirements, regulatory requirements.
Right.
They don't know anything else.
Right.
So they they are fresh starting the internship, and this 1 year they have to go through the changes, the difference in culture, difference in communications, and huge pressure of this internship requirements,
Right.
the studies and assignments, and there are lots of things they have to go through. Technically they have to learn all this practice here.
Right.
Okay, so together within this 1 year, it's not possible, to be honest.
So while settling in a country,
Yeah.
having left their
Yeah.
original country,
Yes.
while adjusting to it, while adjusting to life in a new country,
Yeah.
the pressure of also delivering while working,
Yeah.
delivering the outcome as a worker
Yeah.
in the pharmacy industry, plus all these assignments and assessments and upskilling, plus learning the new system. In 12 months, you're saying is
No,
not enough.
not enough.
And yeah.
No, you just use the logic, it's
Correct. It's too many things
too
happening
many
in a very
things.
short period of
Yeah,
time.
because as human beings, just when we come to a new atmosphere,
Right.
definitely first of all, it's away from their home.
What they used to, yes.
Definitely, it will take some time for them to.
Correct.
But the next day they are starting here. The learning process and they are puzzled.
Right.
That's what that's what I expect from my experience.
Yeah. No, that makes sense because we're exposed to too many things.
At once. Yes. Yeah.
Right.
Yeah.
Okay.
That's why we hire them 1 year before, and they go through all this. Take their time, understand, prepare, and I ask them to visualize,
Right. Yes.
and dream about. Even I talk to them these are the rural areas, and maybe you will be placed these areas.
Right.
Just check out on those
Research
places.
on these,
See
yeah.
about New Zealand, how New Zealand is. So it's like a visual transition.
That's wonderful. That's wonderful because the candidates coming through KETS Consultancy services could be, and you mentioned, be placed in rural pharmacies as well.
Yes.
So a little bit of research in the area, what's happening, what is it known for, before they actually step their feet here.
Exactly.
That's a good thing.
That's what I would like to add, because KETS placed all our candidates in rural pharmacies.
Right.
That's where, as I said, in rural pharmacies, the pharmacies were shutting down.
Right.
Closing down. And I wanted to help them.
Right.
And one of the pharmacy I came to know, and I could place one of the candidate there. And no one of any of our candidates in Auckland.
Right.
Even one in Wellington, but it's in rural.
Right.
Yeah.
Right.
Yeah.
That is good because a lot of times people are okay to fill the vacancies in the bigger cities,
Yeah.
but no one wants to go into the rural New Zealand
Yes.
where there is a shortage
Yeah.
and a need.
Yes.
Nice. I like that aspect of it as well, and that's where you are really helping the community
Yes.
by going through.
Yeah,
through the-
and the other aspect I would like to say, like, I would like to serve the industry. I mean, the community. I mean, definitely community.
Yes.
And I don't charge the pharmacies.
Right.
Yeah, I do this as a service, but I don't know. I don't know how much I have reached
Right.
this. What I'm doing.
Right,
Okay,
right.
so I would like to serve. Okay, you. I'm only relying on this fees. I said, like, for these 2 years we do.
Right.
Our time, our trainers, everyone, everything. It's expensive, and we are relying on that.
Correct.
Okay, but still we are not charging the pharmacies, because we see this as a service to the industry.
Right.
Yeah, this is to be honest, as KETS Consultancy Services, I will continue doing the service until the shortage is fully addressed. And I have other venues, other businesses as well.
Yes.
So I'll be focusing on those.
Right.
Okay. So I'm not seeing this as a business.
Right.
I'm seeing this as a service.
To really help
Really,
the
yes,
pharmacy
yes,
industry in New
yes,
Zealand. is
yeah.
about.
So once it is completely addressed and it's resolved, yeah, I have other businesses I'm passionate about. I'll be focusing on my research,
Yes.
I'm interested in psychology, and I have the collaboration with one of the psychologists organization, and we are doing counseling in India.
Right.
Yes, like
yes.
how we can collaborate with mixing the European system of practice
Right.
with the Indian, what's the existing system in India,
Right,
and then how we can, because I experienced that. So I would like them to know these are the experience, like how they can focus on their well-being.
Right.
Actually, Asian system, they don't think about well-being.
Yeah. I know. I absolutely hear what you're saying, because for any workforce that you get into, it needs to be a holistic approach rather
Yes.
than just focusing on the technical.
Yes, yeah.
We know that if any employee, if they are feeling well, feeling good, pumped up, and holistically they are one, then obviously the result will be seen on the floor with what they're doing.
Yes.
Yes.
I have shared this with a few of the pharmacy owners. Like, my vision is all the pharmacy owners should go for holidays.
Right. Yes. That's a good idea. Yeah, they need a break.
I have seen. Yes, I have seen. I know. I mean, I have seen pharmacy owners. They come by 5 a.m. in the morning.
Right.
And they leave the pharmacy 8:30 p.m. in the evening.
Wow,
And
long
no
days.
breaks, no holidays, they don't get time with the family. How? So so that's why I would like to help you guys.
Right.
You know.
Yeah. Now that's brilliant, and I'm sure your services are tested and tried,
Yes.
and we're only getting better.
Yes.
Through
Yes,
our
yeah.
services.
Every time we are refine. I'm refining each day by day. I'm refining what I can be added, what more training I can provide, so they can be more finer product.
Correct. Yeah. No, that's brilliant. The next question I have is, we know OPRA training organizations are sending a lot of candidates into the system.
Yes.
We briefly touched on it. Why do you argue that the current regulations don't necessarily need changing, but rather the training and the implementation pathways need change?
Okay. Currently, council is open for feedback about how we can bring the more overseas pharmacists here.
Sorry, so New Zealand Pharmaceutical Council, is that?
New Zealand Pharmacy Council.
New Zealand Pharmacy Council.
New Zealand Pharmacy Council currently open for the feedback of how we can bring more overseas pharmacists here.
Okay.
Yeah. So what should be changed? So the regulatory aspects.
Right.
So what council can do about that?
Right.
Yeah. So so you are talking about that, right?
Correct.
Yeah.
Yes.
I don't know about because a lot of overseas pharmacists are like in queue.
Right.
Yeah, like opera trained.
Right.
And meeting all the regulatory requirements.
So you're saying the regulations, what is set is fine.
Influx, I can't clearly comment on the all because it's open for feedback, anyone can do.
Right.
But from my point of view, I think a lot of overseas pharmacists are coming right now, meeting all these regulatory requirements.
Right.
Yeah.
Right.
So for non-REQR I'm talking about.
Right.
Because I did only with the non-REQR candidates.
So REQR.
And
what is that?
Yeah, it's REQR pathway.
Right.
Means it's coming from Australia, UK, Canada, US, English speaking countries.
Right.
So they can directly come here and do 1 month internship and do the legislation interview, and then they can register.
Right.
Yeah.
Okay.
So it's and there is we have to go through non-REQR people has to go through lots of requirements, but their requirements are very less. They can directly come into practice with couple of months training and meeting the requirements.
Right.
Yeah.
Okay.
Yeah.
So regulations wise, as you said, you can't comment too much because that's done by the council.
Yeah.
But rather you can talk about the training and the
training. Yes. Because I have seen a lot of overseas non-REQR pathway candidates coming now.
Right.
That council is overridden with the applications, and they cannot process within time because next the March the legislation course is starting.
Right.
And there are lots of applicants there, so that they get approved, only then they can go for the legislation. So lots of applicants are pending, applications are pending.
Right.
So that's what is happening. So that means influx is high.
Yes.
Yeah.
Yes.
So I don't know why we need to change the regulation. Maybe I would like to suggest the CAPS or OPRA, the exam validity can be increased other than 2 years to 3 years.
Right.
So then more candidates will be eligible. Yeah, obviously still lots of people applying.
Right.
Okay. Yeah. So no, it's. I would like to say it's not just the numbers, but how many. So I think out of 35 candidates, very few passed.
Right.
All others failed.
Right.
Then how the numbers can be we cannot rely on numbers, right?
Right.
Yeah.
Because there could be 100 coming in, but
at the
how
other
many,
end only how many comes to the system.
Right.
That's why KETS is focusing on training them and supporting them until they are registered.
Right.
Yeah, because that's what needed in New Zealand.
Right.
That's what the industry need.
Right.
They need, if I'm helping, KETS is helping the industry, means we should make available the pharmacist in the system.
Right.
For that, there is lots of process.
Right.
Yeah. Then we have to prepare them through all this, and when they go through this culture and the transition and the communication, then only they can pass the final assessment.
Yes.
That's where they're failing. So people are coming, lots of people are coming, but then they cannot enroll into the system.
Right.
They fail in the assessment.
Right.
Yeah.
So people are coming in to fill the graduate void.
Yeah.
But as they go into the next phase, which is the internship, and then you become a pharmacist.
Yeah.
in that process they are falling. Right. So the break is not in how many people can come fill.
Yeah.
Obviously they will have to meet the criteria
Yeah.
to fill the application.
Yeah.
Or the vacancy.
Yeah.
But once they are here, once they are being trained or are being trained in the process of attaining their internship,
Yeah.
they are falling.
Yes.
Right.
Yes.
And this is where the power of KETS comes in.
Yes.
Because you are in that journey of becoming attaining their internship, you are helping them.
Yeah.
And you are taking a lot of pressure off the pharmacy owners.
Yes.
And you are coming and training them rather than relying on the pharmacy owners who, as you said, are already working very long hours.
Yes.
To keep their business going. You're taking a little bit of pressure off them by saying, we are placing candidates in your pharmacy and we will train, obviously with their help, the pharmacy owners' help, but we are taking a lot of pressure off them.
Yes.
By training them in the technical aspect, but also in their well-being.
Yes, exactly. Yeah.
That's
See, to be honest, because for internship, the pharmacy owners or, there should be a pharmacist as a mentor. Okay, so they have to register with the pharmaceutical society.
Right.
They have to go through that training, and then only they can become a preceptor.
Right.
Okay, and they are investing their time for these candidates.
Right.
And it doesn't come fruitful.
Right.
Because they fail. Right?
Yes.
Yeah.
Because they're already juggling and handling so much.
So much.
In the 5-10 minutes, so to speak, they're trying to fill that by training a graduate who isn't able to grasp so many things so quickly because there's already a lot of things happening in their system, their life to settle into a new country, and then all of a sudden in a very, very short period of time, they are expected to learn, and that's where obviously they're failing.
That's where system crashed down. Yes.
Absolutely.
Yes.
Yeah, it's almost a recipe for crashing, right? Yeah.
Yeah.
Cool. All right, thank you. Break.